I completely understand having anxiety and your worries, but having a vaccine protects you against getting COVID-19. My name is Dr. Kiran Morjaria. I'm a junior doctor and a YouTuber based in Manchester. Today I'm answering some common questions about vaccines. Let's get into it. Does the vaccine hurt? Will people make fun of me at the vaccination site if I tell them I'm afraid of needles? The vaccine is an injection that goes into your arm, so it might be a little bit uncomfortable, but it shouldn't hurt. It's no different to the feeling of having a blood test or having a normal injection. If you are scared of needles, you should speak to the vaccination site beforehand. You might be able to discuss with them about if you don't want to have a look while they're doing the injection, if you want to not be told when it's about to happen, because having a fear of needles shouldn't stop you having the vaccine if that's what you want. What if I'm allergic to foods or other medicines? Can I still have the vaccine? This is a really good question and something that people seem to be worried about. If you have any allergies to food or other medicines, it shouldn't stop you having the vaccine. If you have lots of serious anaphylactic reactions, you should let your vaccinator know beforehand because this may be a contraindication to having it. If you have an allergy to a vaccine in the past or any ingredients of this specific vaccine, then those are cases in which you may not be able to have this vaccine. But for example, if you only have allergies to something like peanuts or penicillin, you're still good to go and eligible to have the vaccine. How do we know that the vaccine doesn't have long-term side effects that will impact us in 10 to 20 years down the line? Some of the common short-term side effects of having a vaccine include having muscle aches called myalgia, having a sore arm, a bit of a temperature, and a headache. These are really common and will normally subside. In terms of side effects, it's extremely rare for any vaccine to have any long-term complications. And actually, having a COVID infection, we know, has caused problems long-term in something we call long COVID, where people are getting breathlessness, people are getting palpitations, so the feeling of the heart racing, people are having tiredness long after that infection is cleared. So actually, the risks of having a COVID infection far outweigh the very rare risk of there being any long-term consequences of having a vaccine. I regularly struggle with my mental health and sometimes experience anxiety. I want to get vaccinated, but I'm worried I might have a panic attack or something similar. What should I do? This is a really valid concern, and the first thing you should do is speak to the vaccination hub where you plan to have your vaccine. They've got really experienced staff on site, and all year round they've been giving these vaccines. So they've met people before who have anxiety, who have panic attacks, so they understand what you're going through. There are staff there who are trained to deal with such circumstances. So if you were to have extreme anxiety and a panic attack, there are people there who can help you. I completely understand having anxiety and your worries, but having a vaccine protects you against getting COVID-19.